So now we're going to take a look at some axial blood vessels. I'm going to throw some appendicular in there to tie this all together, but the main focus of this video is axial. We're going to use Jim here as our faithful model. It's uncanny how long he can stay still. So let's get started. Normally a heart would be here, but we've taken that out so you can get a good view at the aorta. You can see how it actually extends all the way down into the abdomen. Off of the aorta, we have that brachiocephalic trunk, and then we'll give rise to our right common carotid artery and our right subclavian artery. Then we have our left common carotid artery and our left subclavian artery. What you can also see up here is our superior vena cava. And what drains into the superior vena cava is the right and left brachiocephalic veins. What drains into those is our right and left subclavian veins, along with our right and left internal jugulars and then external jugular veins. So moving down a shift, we are looking at Jim's abdominal arteries and vessels. So what we see here is this large red one is our abdominal aorta. Its very first branch is called the celiac trunk, and off of it is the left gastric artery, the splenic artery, and the common hepatic artery. And then off of that, we'll get two branches. These are the renal arteries, and they'll supply blood to the kidneys. The next branch will be our superior mesenteric artery, which will feed blood to a lot of the intestines. Then the next will be these long shrink-like vessels, and these are our gonadal arteries. So they'll feed the ovary or testes, whichever is applicable. And then our last branch will be our inferior mesenteric artery, which will feed the rest of the intestines that the superior does not feed. And then at that point, we are actually branching off. So we will have our common iliac artery. Once it branches off, it'll have an internal iliac artery, which will stay inside the pelvis. And then it'll also have an external iliac artery that will continue down into the leg to eventually give rise to the femoral artery. But going back inside the abdomen, let's now look at that giant blue vessel. So this is our inferior vena cava. It has the renal veins branching off of it, so it'll drain blood from the kidneys. And then it also has the gonadal veins, so it'll drain blood from the gonads into the inferior vena cava. And then the inferior vena cava has the same split, so it'll give rise to a common iliac vein. It'll then also give rise to an internal iliac vein and then an external iliac vein. Notice that the inferior vena cava has a lot less branches off of it than the aorta. And that's because the blood coming back from the organs supplied by these branches come back through a special system called the hepatic portal system. And then one last note, when talking about these vessels, always make sure to include right and left where it applies. For example, the abdominal aorta, there's only one, so there's no right or left. But the common iliac arteries, we do have a right and left. So here is our left common iliac artery, our left internal iliac artery, and our left external iliac artery. I highly recommend when you are studying to throw in the right and left and the arteries and veins. It'll make you better prepared for the exams because you really just don't want to miss points for not including those itty bitty tiny things. So these are the abdominal arteries and veins taken out of context, but this is what we call a freestanding urinary model. So let's start with the big red one in the middle. That is our abdominal aorta. Again, the first branch we have is our celiac trunk. Then we will have our superior mesenteric artery or the renal arteries right here, whichever comes first in the model. So our renal arteries will supply blood to the kidneys. Our superior mesenteric artery will supply blood to intestines. Then we have our gonadal arteries right here. Then our superior mesenteric artery. And then again, this whole large red vessel is called our abdominal aorta. It'll then split into the iliacs. Because there's no differentiation between the external and internal iliacs, we'll just go ahead and call these the common iliac arteries. Now going to the big blue thing in the middle, that is our inferior vena cava. So again, we have some branches from the renal veins. So this is drawing blood from the kidneys. And we also see the gonadal veins, which will draw blood from the gonads. And then again, it'll come down and it'll split into our common iliac veins.